Hand hygiene is considered as the cheapest yet single most effective practice to prevent and reduce the transmission of infectious agents in the healthcare setting. It can prevent and control the occurrence of hospital-acquired infections and spread of infectious diseases, as it minimizes microorganisms acquired on the hands during daily clinical duties and when there is contact with blood, body fluids, secretions, excretions, and known or unknown contaminated equipment or surfaces. But when is the best for the healthcare workers to observe hand hygiene practices? The World Health Organization introduced the 5 moments of hand hygiene as an approach to remind the healthcare employees to adhere to hand hygiene practices during these 5 crucial events. Before touching the patient, before clean aseptic technique, after body fluid exposure risk, after touching the patient, after touching the patient's surroundings. In the healthcare setting, hand hygiene can be observed either through hand washing or hand rub. Hand washing refers to the process of cleaning hands for 40 to 60 seconds through the use of soap and water. The best time to perform this procedure is when the hands have visible dirt or after being exposed to blood and body fluids or contaminated surfaces. As recommended by WHO, here are the steps on proper hand washing. Number 1. Assess the hands by keeping the natural nail tip short, less than 1/4 inch long. Removing artificial fingernails or extenders as well as all jewelry and checking the hands for breaks in the skin. Number 2. Turn on the water and adjust the flow. Number 3. Wet the hands by holding them under the running water, lower than the elbow so that the water flows from arms, least contaminated, to fingertips, most contaminated. Number 4. Apply enough soap. If the soap is liquid, apply 4 to 5 ml. If it is bar soap, granules or sheets, rub them firmly between the hands. Number 5. Wash the hands using firm, rubbing, and circular movements following the steps. Rub hands palm to palm. Left palm over right dorsum and vice versa. Palm to palm with fingers interlaced. Back of fingers to opposing palm with fingers interlocked. Rotational rub, right thumb clasped in left palm and vice versa. Rotational rubbing, backwards and forwards with clasped fingers of right hand in left palm and vice versa. Number 6. Rinse hands with running water and dry hands with a single-use paper or cloth towel. Number 7. Use the paper towel to turn off the hand-operated faucet. Number 8. Both hands are now clean. Another type of hand hygiene is the hand rub. Using 70% alcohol-based solution or gel for 20 to 30 seconds, this procedure is preferred when cleaning the hands that are not visibly soiled in between clinical activities. Based on WHO, here are the steps on proper hand rub. Number 1. Assess the hands by checking the hands for breaks in the skin. Number 2. Apply a palmful of the product in a cupped hand, covering all surfaces. Number 3. Rub the hands using firm and circular movements following the steps below. Rub hands palm to palm. Left palm over right dorsum and vice versa. Palm to palm with fingers interlaced. Back of fingers to opposing palm with fingers interlocked. Rotational rub, right thumb clasped in left palm and vice versa. Rotational rubbing, backwards and forwards with clasped fingers of right hand in left palm and vice versa. Number 4. Once dry, the hands are now clean and safe. As a healthcare worker, it is our duty to observe these hand hygiene practices to prevent and control the spread of infection, keeping Bicol Medical Center safe for both patients and employees.